Does your board reflect the diversity of your hospital or health system in terms of staff and the patients and community you serve? Does your board measure and understand disparities among your patient populations? How does your board ensure that patient diversity and disparities are accounted for as quality improvement and harm reduction goals are set?
The national call to action to eliminate healthcare disparities was launched a few years ago by 5 national organizations, including the American Hospital Association. It set out an ambitious goal to eliminate healthcare disparities in our country for all citizens. And there are 3 priorities that you, as a trustee, must be aware of and ensure that your organization is working towards. The first priority is to collect and use race, ethnicity, and primary language data of your patients. Collecting that helps you to know your patient population. And the second part is using that data to look at your quality information, your safety information, to see if there are any disparities between different races, ethnicities, or language styles of patients. The second priority is ensuring that all your caregivers have cultural competency training. We know different patient populations have different cultures, and so being sensitive to those cultures and understanding how to work with those in healthcare is critical. And the third priority is increasing diversity in the leadership and in the boardroom. So 3 priorities that we know can eliminate healthcare disparities. The trustee role is to ensure that your organization is systematically collecting the data and using it, race, ethnicity, and language preference of your community.
It's an exciting time for us to really be thinking not just about the average patient and improving harm across the board for the average patient, but tailoring our strategies for special vulnerable populations who don't get good outcomes now, and really creating the ways in which we can listen to them better. And that needs to be modeled at leadership too. People are going to feel more comfortable talking about this if there are other people in the room who are their color or are their age, or they can relate to in some other way. So it's a big challenge. It's an old challenge. It's a problem we've been kind of kicking down the road for a while. But there's some real momentum that's been built around this in the first couple of years of the partnership. We've done a lot of programming on vulnerable populations and diversity. HRET has been a huge contributor to that programming, and we're really excited about building on that in the next year.
We know that having a diverse boardroom will allow for honest conversation, differences of viewpoints, and diversity in perspectives from all sides, race, ethnicity, age, gender, only add to the robustness of the conversation, and knowing your patients. So diversity is an important piece. Diversity in your leadership team is in the same vein. Understanding different views, having individuals from different backgrounds, again, helps us to understand our communities the best, which is ultimately our mission to improve the health of our communities. So diversity is so tied to disparities because it allows us to bring in multiple voices, multiple perspectives to get to your whole community.
It's important that the board reflects the community that it serves in many ways, but most importantly because it sends a strong message to the community and to the caregivers about the organization as a whole. Diversity plays a key role in our overall management plan and strategic organization, and a strategic plan for the organization, and part of that is driven by the commitment by both the board and the senior management team to make sure we reflect our community. It's important for me to sit on a diverse board because what comes to the table in the conversation is not only a robust conversation, but also a diverse opinion and thought. The variety of players at the table bring not only their experiences and their business background, but a thought process that allows us to really have a great conversation and debate issues that are critical not only to the organization but to the patient population we serve. What I bring is not only 30 years of business experience, but I also bring a perspective of inner city individual that grew up in a poor area and understand the needs of the community. Having a business and finance background was a natural transition to sitting on the board. However, sitting on the Quality and Patient Safety Committee really helped me understand not only the undertakings and what it means to really serve this population, but more importantly, how critical it is to make sure this population has the care that they need.
So one question you as a trustee in your role is, how do we get diversity in the boardroom? And there's lots of great ways. Number one is, in your nominating governance committee, you should have a slate of competencies and diversities that you're looking for. So having that pre-planning is critical to move forward in diversity. The second piece is there are great sources out there to find diverse candidates to meet the competencies you need for your governance and your leadership team. Resources in your own community, resources from the American Hospital Association through our educational programs, and resources nationally in terms of other associations, membership groups who have individuals who are steeped in healthcare knowledge and can contribute to your community and the competencies you need for your board, whether it's financial, whether it's patient safety, or whether it's legal or other areas.
To quote the business guru, Peter Drucker, what gets measured gets managed. If a board is not reviewing and asking questions about disparity, how can they effectively eliminate harm within their organization? It's critical for the board to really understand the diverse population that they serve. By not understanding the population they serve, how can they really reduce harm within the organization? Having board members participate in the cultural competency training helps them better understand the issues within their organization. It also sends a very strong signal to caregivers that the board actively cares and sees it as an important issue. Our quality committee sets goals based on standards and measures not only from an industry standpoint, but also internally based on benchmarks from our previous experience. We have a dashboard focused specifically on key measures associated with not only harm, but then also disparities for our organization, or disparities for the patient population that we serve.
One of the things that a board can do when they're looking at their quality data is to look at the data and divide it by the Institute of Medicine's aims of care. And one of those aims is the aim of equity. So looking at your data by race and ethnicity, you can identify disparities, and then a board can think about its strategy and look at services or care that might be missing or might need to be provided in an organization. They can also look at gaps of care and then implement changes in the organization in order to close those gaps in a way that really gets to the population health of an organization and gets at improvement in the communities around the organization, not just in the sense of individual care. And that's an important focus for boards today as they try to improve the health care provided by their organization.
Our issues are compounded by not only just the health issues that our patients walk through the door with, but also their social determinants and their background and the difficulties of their daily life compounds what we need to manage and help them through improving their overall health. So because of the disparities of the population we serve, we have a dashboard that is inclusive of those key metrics around breast cancer, obesity, and diabetes, because that is critical that we help improve the health of those individuals, which is thus improving our quality measures. Goals around disparities and quality measures are clearly set on an ongoing basis. We have key dashboards that allow us to have a snapshot view, and during the quality meeting, we may actually dive into any particular category that we feel we're falling short on. The board is actively engaged in helping set the standards as well as holding management accountable to meeting the goals. Our mission with the patient isn't done once they are discharged from the hospital. We see it as a vital part of treating patients with disparities as the next best step for them, inclusive of support in a language that they can understand. That includes helping them make their next appointments, ensuring follow-up, because part of our disparities measures is the intervention component, and have we done, are we doing everything that we can to minimize further problems with those same issues that they came in our front door with the first time around? A key element of addressing disparities is ensuring that you're collecting data on your patient population that allows you to really dissect and understand the needs of that community. So a couple of tips that I will offer to boards that not only help with improving diversity, but then also disparities. One of my tips would be to ensure that board members have a mentoring process in place. I, as a non-clinician, only agreed to chair patient safety. if I could have a partner from the clinical side. And that has worked very well because I bring a process and a business background that maybe was not considered a part of the overall process previously. So I would encourage boards to make sure that they have a mentoring process, not only just in the onboarding, but as board members rotate through committees, it's important that they have a comfort level with the conversation, and having that board mentor is a critical part of improving the conversation and the comfort level of the individuals.
In order for boards to be most effective, they should reflect the diverse makeup of the patient population and communities served. Boards must be aware of and ensure that strategies and tactics for reducing disparities are clearly set and followed out. Disparities in care and patient diversity must be key factors for boards and hospital or health system leaders when collecting data and setting overall patient care and quality improvement goals.